Welcome back to Cablevision's Hudson News Edition. I'm Sherry Carabin. Today is the 31st Annual American Cancer Society Great American Smokeout. It's a time when people are asked to quit smoking at least for a day in an effort to encourage them to look into giving it up altogether. Dr. Gabriel Kaplan, Director of Psychiatry at Hoboken University Medical Center, joins me now to talk about what's really involved in quitting smoking. Thank you for being here.
Thank you for having me.
What is really involved in quitting smoking? It's obviously not giving it up for just one day.
Right. It's a lot more complicated than that, but there's a lot of hope. And I guess the first question that people have is, why quit smoking? Well, it's very simple, because it's bad for you. It can kill you. It gives you all kinds of cancers. It smells bad. It stains your fingers. It can affect unborn babies. And unless you're a shareholder for a tobacco company, there's really not a good reason to smoke. But it's a very difficult thing to do because it's an addiction. When people smoke, what they're doing is they're bringing nicotine into their systems. And nicotine is a very powerful substance, very addictive. People don't understand or they don't know that, but it can be compared to heroin or cocaine. So what happens is that when people try to quit, they get withdrawal symptoms. And the withdrawal is a sign that the body has to rebel against the absence of nicotine. So it's very important that one make a decision to quit smoking. That's a decision that's a very personal one, can only be made by the individual. But once you make that decision, there are many things that you can do to facilitate that quitting cigarettes. And the way you do it is you set a date. You tell yourself, I'm going to be quitting this particular day, and that's why the smoke out is good, because it encourages that sort of thing.
How does that exactly work? The smoke out, how is it intended to work?
Well, you have to quit for at least one day, but that gives people the encouragement to actually continue. And so once you select this date, then what you do is you have to deal with a withdrawal. And there are many ways in which people can deal with this withdrawal, and the withdrawal can be very significant. People can be upset, they get depressed, they increase weight, and so a small minority of people can do it on their own, just by toughing it out, quitting cold turkey, talking to people.
What about the others?
But the others have many options. The most available and free option is just to call a helpline, a quit smoking line. There's one by the American Cancer Society. People can do that. They get in touch with telephonic help. If that doesn't work out, then you can do something that's called nicotine replacement therapy. And what you do is you trick the body into believing that you're smoking without smoking. So you give your system some nicotine.
Like a patch?
A patch. And the patch, there are a few ways in which you can deliver nicotine. When it's a patch, you put the patch on. It's very good. If you don't like the patch, you can do the Nicorette gum, and there are other brands that you can use. You chew the gum. There are a couple of other things that people can use. They're less known with nicotine. One is a nicotine spray, a nasal spray, and the other one is an inhaler. And if that's not enough, then you can go to some more powerful medications. If you visit a doctor, there are two medicines that have been shown to help with craving. One, it's called Zyban, and Zyban can also be used for depression. But in this case, it's approved by the FDA to help you quit smoking. If Zyban is not appropriate or not effective for you, there's a new medication called Chantix. And Chantix is only for cravings, for smoking cessation.
Do these medications have side effects?
They do have some side effects, and that's why you must be under the supervision of a physician, and they're available only by prescription. Now, what most people do in order to increase their success is to actually combine some of these techniques all together. So you might be on the patch, you might also take one of the prescription medications, and overall you need to get the counseling to offer you the support in order to go through the withdrawal and the craving. But chances of success are reasonable. About maybe 1 in 3 people who quit are able to stay smoke-free within 6 months. It's important not to get discouraged. Many people have to try and quit a few times. Mark Twain said, quit smoking is very, very easy. I've done it 1,000 times. And so at some point you get to that level where you really believe that smoke is going to kill you, and then you stop doing it.
So if the first time you don't succeed, you should try again.
Absolutely. Do not get discouraged. Chances are that if you keep doing it, you're going to succeed.
All right. Well, thank you very much for joining me here today to talk about this.
You're very welcome.
If you would like more information or help quitting, you can call 201-792-8200. And don't go away because we'll be right back.